Great. So thanks everyone for joining us today. We welcome you to this webinar, Dumped Power Shifting, and we will be learning from 3 country case studies, India, Sierra Leone, and Côte d'Ivoire, how Momentum Country and Global Leadership Project in the past 2 to 3 years has used a network approach to build an enabling local actors environment to effectively drive locally led health development. Next slide. I would like to share a few logistics or housekeeping, not here just to make sure that all of us can effectively engage throughout the session. We do have a French interpretation, and for those who prefer to listen in or speak in that language, I kindly ask you to check at the bottom of your Google screen. There is a globe button on your screen. Click on the interpretation link and choose your preferred language. If you have trouble hearing your interpretation chosen channel, I do request that you use the question and answer button to let our tech team know that you are having an issue, and they'll be able to troubleshoot with you as soon as possible. I would also like to mention that we do have the question and answer space created for all of us participants. I hope you can see it next to the share the screen button. And that is a dedicated space for all of us participants to answer questions, share your insights or comments. We will be tracking your questions throughout to ensure that either we write the presenters, engage with all of you in written responses, or to respond to your questions at the dedicated question and answer time. If again you have trouble accessing or writing, so you could either email, but we hope that with the testing that we've done, you should be able to effectively engage through the Q&A button down there, or space. Next. Let me run us through the agenda for today. It is not only jam-packed, but actually, helping us to learn a lot in the next 90 minutes. And we'll be having an opening remarks from Erin, Reproductive Health Senior Technical Advisor from USAID, Washington. We will be run through an overview of the Advocacy and Accountability Collaborative Network Model and approach that has been behind powering the implementation and technical assistance and civil society organizing across the 3 different countries whose case study presentations you'll be hearing today from India, Côte d'Ivoire, and Sierra Leone. We have a dedicated session for questions and answers, and we will be having remarks from HIA, USAID Sierra Leone, a team that has not only been a champion of the TAAC Network Hub in Sierra Leone, but a very engaged partner. And we will have our closing remarks. Kindly, the chat is closed for security reasons, and so do not use it because we will not be able to see your questions, answers, or insights. As I stated before, use the dedicated space marked questions and answers. Next. And now I hand over to Erin for opening remarks.
Thank you, Angela, for the kind introduction. And good morning, good afternoon, and good evening, everyone. It's a pleasure to welcome you all to this webinar on power shifting, how a network building approach is enabling local actors to drive locally led development. As part of USAID's management team for the Momentum Country and Global Leadership Project, I have had the privilege of supporting the family planning and reproductive health advocacy and accountability work since the project began. Today, it's great to be able to share with all of you the progress we have made and to be together to learn directly from our partners in Côte d'Ivoire, India, and Sierra Leone about their experiences. Advocacy and accountability play a critical role increasing access to and use of quality family planning services based on evidence and best practices. While there's an important role for advocacy and accountability at the global level, such as through the FP 2030 initiative, today we are excited to focus on the experience at the country and local level. This experience ranges from holding stakeholders accountable to their national FP 2030 commitments and national financing for family planning programs, to demanding reform at the local level and ensuring that decision makers hear from the people directly impacted by their actions. Engaging in advocacy and accountability can improve the pace, scope, and quality of change to address ongoing challenges in family planning and ensure that words or pledges translate into meaningful action and service delivery. Since 2021, USAID's Momentum Country and Global Leadership Project has partnered with the Advocacy and Accountability Collaborative, referred to as TAAC, to accelerate progress to improve family planning and reproductive health in Côte d'Ivoire, India, and Sierra Leone. To advance policy dialogue on FP and RH, the initiative works through an organized country hubs model that links organizations, networks, and individuals to accelerate progress. It is important to highlight that the local partners in these hubs include youth-led organizations and networks that have a deep understanding of and connection to the impacted communities and key decision makers. Now I look forward to hearing more from our speakers about how TAAC Hubs in Côte d'Ivoire, India, and Sierra Leone are driving locally led development and leading to policy changes, domestic resource mobilization, and increased political visibility and prioritization, including for adolescents and youth reproductive health. Now I will pass the word over to James Nyaga, Advocacy and Accountability Technical Advisor for the Momentum Country and Global Leadership Project and based in Kenya.
Thank you, Eileen, for passing the baton to me. I'm James Nyaga, Advocacy and Accountability Technical Advisor at the Momentum, based out of the office, Nairobi, Kenya. The world today acknowledges that the many commitment, sound policies, and service delivery investment in healthcare cannot be sustained without rethinking and investing in local environment. The science impact of P2030, USAID 30, population, health, and environment, sustainable development goals, every woman, every child, as well as country, regional, and global conversation, commitment, and actions cannot be realized without sustained actions from the local actors of the affected countries and their communities. The TAAC network model is therefore designed to respond to the locally-led development opportunity by amplifying local knowledge, expertise, voice, and evidence use by local indigenous organizations. As we know, voices of local civil society partners are often siloed and uncoordinated. The TAAC network model allows the local actors to self-evaluate and co-create a platform that galvanizes their collective voice and assets to improve their program, design, delivery, and learning exegesis. Next slide. TAAC network model response to health sector local development seeks to, one, galvanize a critical mass of advocates needed across decision-making levels in the country, FPRH, MNH, gender, and nutrition sector. TAAC sharpen the capacity and collaboration of the local civil society partnership, indigenous and grassroots organization networks, and especially women and youth-led organizations to accelerate collective advocacy and accountability efforts at the country level, while ensuring strategic regional and global partnerships are leveraged in support of country and global goals realization across the RAMCA continuum, as well as addressing other emerging priorities such as COVID-19 and health development overall. Next slide. To inform the TAAC network model and purpose, civil society advocates met in Nairobi during the ICPD Plus 25 conference in 2019 and built consensus on 3 priorities of joint focus. 1, to pursue sustainable domestic resource mobilization. 2, increase data use for advocacy and accountability. And 3, foster improved joint accountability for results. These priorities, and especially fostering accountability, are also in line with FP 2030 priorities for countries and partners actions, as well as in other global initiative and commitment for health. To pursue these priorities, the civil society agreed to pursue 3 broad programmatic actions. 1, learning exchanges, co-creation, execution of joint implementation strategies, and coordination and leadership improvements of the networks and member organizations. Next. The view of change that you can see was summarized after the Nairobi TAAC partners consultations and articulation of the priorities for joint action that I've just shared. The TAAC aspiration, as you can see, is to start small but build presence in 3 geographies, just to mention Africa, Asia, and the Americas, the Latin America, actually. Next. I will run through the TAAC network structure and reach. It's good to know that TAAC builds on existing investment and networks. If no existing and functional networks, new ones are created. In terms of structure, there are 3 levels: the Global Secretariat, country hubs, and the TAAC membership. In each level has its own functions. In brief, I will give a brief illustration for function for each of the level. Level 1 is the Global Secretariat. The Global Secretariat provides oversight to country hubs, and the technical and the Global Leadership Secretariat is made up of technical and advisory group whose members are drawn from low, medium, and income countries and selected regional and global expert and networks. TAAC Secretariat executes day-to-day tasks and is currently hosted by Japaigo out of Kenya office. Some of the functions of the Global TAAC Secretariat, including providing and coordinating technical assistance to the country hubs, including brokering technical assistance from partners. The Secretariat also lead or coordinate and facilitate country, regional, and global linkages. At level 2, which is the country hubs, basically the country hubs drive priority setting and execution. In so doing, they provide coordination of the membership at the country level, support knowledge management, lead in data generation or landscape analysis, and also the recruitment and enrollment of TAAC members. Level 3 are the TAAC members themselves, where they get involved in community listening, understanding the needs at the community level that they present. The TAAC members also contribute to coalition-wide implementation of strategies, including leveraging on the resources available to engage in advocacy and accountability action. Next. The heart of locally led development is in listening. and responding to grassroots reproductive health needs and concerns. TAAC therefore seeks to create an ecosystem where vibrant civil society organizations are super-organized and technically equipped to meet these needs. This graphic that you see represents a cyclical approach for the TAAC network to organize its presence and action, to listen and to inform policies, plans, and investment, and accountability for implementation. Next. All what I've shared is meant to lead to certain outcomes and impacts at the country and global level. At the country level, we have visions that the advocates are using data and evidence to achieve policy gains within their government counterparts. And there's a mutual accountability exists between civil society, government, and donors. And that the country plans and commitments are adequately resourced and financed, and that the political will for and prioritization of PRS issues is secured and acted upon. At the country level, we are looking for whether costed implementation plans are operationalized and monitored, and whether targets of the health sector plans are reached, and whether FP 2030 commitments are being honored. At the global level, we are partnering with others to ensure that the fundamental rights of individuals to decide freely and for themselves whether, when, and how many children they want to have is being realized, and whether demands for health sector services are satisfied, and whether SDG 3 and 5 is being met. Next slide. Learning from, so these are the successes that we secured over time, and some of those successes will be discussed in a bigger way by the speakers in the panel discussion that follow. But just to mention that since for the last 3 years, that TAAC membership has strengthened leadership and coordination at 6 TAAC hubs in Kenya and Burkina Faso, Zambia, Côte d'Ivoire, Sierra Leone, and India. There has been a consistent model replication, learning from the initial 2 countries with funding from UNFP, that was Kenya and Burkina Faso, and then proceeded to scale up TAAC model in other 4 countries with momentum funding. We have extensively working generating data to support or inform policy and financing landscape across the 6 countries that I mentioned. We have TAAC has developed a different capacity building resources around data use and institutional strengthening. We have strengthened our partnership globally and regionally with key networks and organizations, including FP 2030, Reproductive Health Supplies Coalition, UNFPA, Samaritan Medical Trusts, African Health Budget Network, among others. And we have worked with the country hubs to ensure that beyond the USAID funding, they are able to attract other funding from other donors. And we worked very closely with Momentum Knowledge Management team to support learning and adaptations. And what we have seen is an expanded inclusion of adolescents and youth and indigenous organizations across our countries and communities. On funding policy and visibility wins, we'll hear more from my colleagues who are participating in the next session. I now welcome Angela Mutunga, Director, Advocacy and Accountability at the Momentum, to lead us in the next case study panel presentation and discussion. Welcome, Angela. Thank you.
Thank you very much, James, for that good layout of what TAAC is and what TAAC is not. Today, our cream of the presenters are actually our speakers who will be taking us through the country case study presentations. We will start with India, and I want to be clear here, so we don't steal the show from the real local implementers. Because of the language limitations, Amit from CINI will be making the presentation on behalf of Manthan and Fika Sathi. Their presentation is going to be focused on diversity, equity, and inclusion, just to for all of you to appreciate how we are engaging and supporting and shifting power to young people so that their needs and policies that are meant for them could be realized across different geographies. Welcome, Amit.
Very good evening, good morning, and good afternoon to everyone all around the world. And it's a great opportunity to be given this opportunity to share. Thank you, Angeline, for the brief introduction. And here we talk about the advocacy and accountability collaborative in details, James and Seth. Here, the objectives around it, and also the stack fosters actualization of those SDGs around 3 and 5, which we are in Jharkhand in India, we have been able to do with your support. This is a collaborative of 43 grassroots CSOs in Jharkhand who have been focusedly working on improving the health outcomes with respect to the sexual reproductive health and family planning among the young people. So with the duration of these 2 years and taking it forward, I would request for the next slide, please. So this is brief a map of the Jharkhand state, which is one of the states in eastern part of India. And here you see that the reach of our organizations, these 43 CSOs have been present all over the state, coming from all remote corners. That's the beauty, that's the success that we have been able to nurture, that we have got the support of these CSOs from every corner, representing every community from different parts of this state. Also, we must mention here that 25 of the CSOs were youth-led, 12 were women-led, and 3 were also part of these youth-led communities. Here also would like to mention here that apart from this, who was the convener of the stack, we had other key 4 NPI partners. To mention first was Manthan, who were focused in bringing better healthcare services to the LGBT community. Vikas Sarthi with us, who have been trying to promote referral services that are being provided to the young people. Also, we had Jan Lok Kalyan Parishad, we call it as JLKP, for better health services, specifically focused on family planning and SRA, on youth generation with the youth clubs around in a particular geography. The last, Public Health Resource Society, who have been working for better quality of life for the girl child. All 4 very diverse, very unique, and reaching out to a diverse community in different parts of the state. Next slide, please. To mention here that though Sini was the convener of this mammoth program here in Jharkhand, we had a dedicated team of the leadership team, which was constituted democratically from these 43 supposed CSOs, and also with support was young team members, the young transgender community representative. We had invitees from at the different moments when we sat together. The advisory leadership team has been very helpful in guiding us and giving strategic directions in every sphere of this functioning. Without this ALT, the TAAC would not have been functioning as it was. It was not alone a CINI initiative. It was, of course, a collective initiative where representation. Also, I must say that in every 4 to 6 months, we again had an election within our team where the advisory leadership team was changed. New members were incorporated, and they provided us the necessary direction in these tenure of what we run the CSO TAAC. Next slide, please. This slide is very important as we see how we have convened the most important TAAC Hub coordination and leadership result areas. I will take little time in this particular slide because it reflects what we have been able to do, what I have been able to achieve, we have been able to accomplish with the support of different people, different stakeholders who are very, very key to this. Apart from the 43 CSOs who have been part of it, government has been very supportive with us. Different cells, not just the family planning cell, but the adolescent health cell, the industries department, and also the livelihood promotion society in our state of Jharkhand. Corporates, the CSR must be a new concept in other part of the world, but corporates who really contribute for social development, they're also pooled in to provide necessary financial support and also identify locations where the need is the most. The media, we cannot be away from the media because they are the one who reaches to the masses. We got the support of 9 print and 16 electronic media houses. We have convened 2 media conclaves in the 2 years where we invited all media individuals from different fields. We shared our stories and they were really cooperative in taking out our stories and reaching out to the masses. Last not least, here we have the academic institutions, one of the premier institutes in Ranchi, the Xavier Institute of Social Sciences and also the Ranchi Central University. They have been part of the ALT as an evaluability member. They have been part in providing necessary guidelines in different aspects of our running throughout the tenure. And also, I must mention that Hubs were published in the Momentum 2023 Progress Report. It was a boost to our confidence that what we are doing. Coming to the data use part, with the help of the data, we came up with a large number of IECs, which were really helpful in circulating among our CSOs and everyone. Next is the capacity build-up here. In the capacity development also, I would like to mention here that it was not just collection of few topics, but this all came through a need assessment where we reached out to every individual according to their need. And with this help, they have updated their policies, those who are the grassroots level. Also like to mention that dialogues, these helped us to 6,000 young people across 14 districts. And also, as I mentioned earlier, networking with the corporates and the media coverage has been very useful. And the last not least, with the support from the corporates, we have been able to leverage funds so that they could sustain their good work in the near future and also continue having these young people on board. Next slide, please. Here I come to the Manthan, who specially work for better healthcare services for the LGBTQ community. They were in the Dhanbad district in 4 blocks. The most important thing, let me come to the achievement part first. They, with their interventions, they got a directive from the state itself for improved healthcare services. Most importantly, a directive for all the government health service hospitals and supported health hospitals to provide better healthcare services, separate washrooms, and to ensure that none are missed out, none are left out. Nodal officers in all the 24 districts which make up the state, they're appointed and who on a day-to-day basis were monitoring that who all are coming to the hospitals are provided the necessary services as they are required. To achieve this, there have been lots of field work. As you can see, I'm not going through the numbers, but as you can see, that they have met with the health functionaries, the community, they have ensured referral services, they have provided counseling services, and also health checkups of regular. The number here is around 48 LGBTQ people came down to the hospitals and those were in critical need of certain services. Next slide, please.
You
Next
have
slide,
2
please.
minutes to
Yeah.
wrap up. Amit, if you could move
Yes,
very
please.
fast.
I will. Very fast. Here's Vikas Sarthi, who promoted the concept of no pay, co-pay, full pay. Not going into the details in one of the cases, but the interesting part here is reaching out to a large number of adolescents and helping them with the support of necessary services from the service providers. This has been the integral part of Vikas Sarthi. These are the 3 approaches that they have undertaken to reach out these. Next slide, please. Key learnings. Quickly, one of the most important slides, the strategic capacity building. These were need-based and not just flat horizontal. The collaborative networking with a large number of people around. The media and creative advocacy who have been a strong pillar in taking our voices to the large number of people and also creating an awareness through this advocacy. And the last one is sustainable engagement with the help of the CSOs, which we could take it forward, just not with the end of the direct intervention period, we could take it forward. Next slide, please. With respect to the sustainable plan, yes, we need the diversified. Yes, perfect. This is the last slide, I think so. The diversified funding agency, not going to in-depth, collaborative capacity building and decentralized leadership and advocacy. These have been, which we are looking forward to with all the CSOs, which we can take it forward. And I think the last slide is with this. Can you take it the last slide, please? Yes, these are glimpses from the field. You can see a large cross-section from the field that we have been able to in these 2-3 years of our intervention period. I stop here, and I think this is the last one. Thank you very much for this opportunity. I end here.
Thank you, Amit. I'll now move us very quickly without summarizing the great work that you've heard from Amit all the way to Côte d'Ivoire, and invite Dr. Lillian from ASAPSU to share the case study from Côte d'Ivoire. You know, this is a very exciting part of the work. They completely decided to focus on one of the hardest areas, that is ensuring accountability for commodity security. So Lillian, take over, please, and be mindful of your 7 minutes. Lillian?
Bonjour à tous. Bonjour à tous. Merci pour cette opportunité que vous nous donnez de pouvoir présenter, partager l'expérience de la Côte d'Ivoire au niveau de la redevabilité sociale, au niveau de la collaboration, de plaidoyer et de redevabilité. Diapo.
Next slide.
Alors, à propos du TAAC en Côte d'Ivoire, la plateforme TAAC est représentée par la coalition existante de la société civile avec 30 OSC, 28 associations locales et 2 associations de jeunesse. Au niveau de USAID Momentum, qui a financé 3 partenaires pour la mise en œuvre du TAAC au niveau de la Côte d'Ivoire, afin de renforcer la coordination du plaidoyer des OSD pour la communauté de la SML et la PF. Alors, nous avons eu le CDS, le partenaire qui était en charge de la collecte des données, ASAPSU, le partenaire en charge de la redevabilité sociale, et AIBF, le partenaire en charge de Diapo. Alors, nous sommes partis de plusieurs limites que nous avons constatées déjà avec la croissance de la population. Il ressortait beaucoup de besoins qui n'étaient pas satisfaits. Et donc, à travers ces besoins non satisfaits, les pays ont pris des engagements à l'égard du FP 2030 qui nous ont permis de ressortir certaines difficultés, notamment la faiblesse du système de sécurité d'approvisionnement des produits de santé et également un très faible financement pour l'approvisionnement des produits en SRPF et SMNI. D'accord? Alors, pour le processus, la mise en œuvre du TAAC en Côte d'Ivoire, le processus s'est étendu en 10 étapes. Nous avons eu à travailler via le mécanisme PET, qui est le Public Expenditure Tracking Survey, qui nous a permis de pouvoir mettre en œuvre le TAAC, la redevabilité au niveau de la Côte d'Ivoire. Au niveau de ces 10 étapes, la première étape était de faire une analyse situationnelle. Et cette analyse-là nous a permis de ressortir tous les problèmes qui existaient au niveau surtout des ruptures de stock. Et donc, au niveau de la deuxième étape, nous avons défini les objectifs qui étaient d'améliorer l'approvisionnement, la sécurité de l'approvisionnement en produits SRPF. Et l'étape 3 nous a permis d'engager, de mettre en place les équipes PET et de pouvoir engager les parties prenantes, notamment avec le groupe technique de travail de la qualité des soins au niveau national, au niveau du district et au niveau communautaire. À l'étape 4, nous avons eu des réunions avec ces différentes équipes au niveau national, au niveau district et au niveau communautaire pour valider les données, ensuite faire une auto-évaluation, analyser et pouvoir prioriser au niveau pour chaque équipe. À l'étape 5, nous avons eu une réunion d'interface qui a réuni toutes les équipes au niveau national, au niveau district et au niveau communautaire pour valider ensemble les plans d'action pour le changement. À l'étape 6, nous avons mis en œuvre ces plans d'action pour le changement et au niveau de l'étape 7, nous avons suivi un peu pour tout ce qui a été mis en œuvre au niveau de ces plans d'action pour pouvoir voir ce qui a permis le changement, de suivre, de pouvoir documenter et faire un peu le coaching. Au niveau de l'étape 8, toutes les équipes devront se poser pour pouvoir réfléchir un peu par rapport aux changements qui ont été apportés au niveau après la mise en œuvre du PES et de pouvoir faire une mise à jour des plans d'action pour le changement. À l'étape 9, nous allons revoir encore le paysage pour essayer d'actualiser tous les plans qui ont été mis en œuvre et voir effectivement l'amélioration qu'il y a eu au niveau de l'environnement de la SRPS, au niveau de la Côte d'Ivoire. Ensuite, à l'étape 8, nous allons suivre, documenter et partager les expériences et les apprentissages que nous avons reçus au cours de la mise en œuvre de la renouvelabilité au niveau de la Côte d'Ivoire. Alors, ici, sur cette diapo, nous voyons un peu tous les résultats que nous avons obtenus avec la mise en œuvre du TAAC depuis 2023 à ce jour. Nous avons eu des engagements au niveau national avec le ministère de la Santé à travers la direction et le groupe technique de travail qui sont engagés. Et également, nous avons eu au niveau district, nous avons eu l'engagement des directeurs. Nous avons eu également au niveau de la communauté l'engagement des chefferies, des communautés, également les pharmaciens, avec au niveau du secteur privé, avec la nouvelle pharmacie de la santé publique. Au niveau des données, nous avons aujourd'hui des outils de données. Nous avons également le rapport de l'analyse situationnelle. Nous avons aujourd'hui un tableau de bord qui est représenté par le plan d'action pour le changement, qui nous permet de pouvoir suivre au niveau national les activités de renouvelabilité au niveau national, au niveau district et au niveau communautaire. Nous avons mis en place un cadre d'échange pour aider le partage d'informations au niveau national pour se partager toutes les informations qui concernent la SMNIPF. Nous avons aussi, au niveau des résultats, 3 équipes qui ont été mises en place. Et ces 3 équipes sont, au niveau national, nous ont permis de pouvoir avoir 3 dialogues avec les décideurs, notamment les directeurs des programmes et aussi le ministère de la Santé. Au niveau du titre également, nous avons eu des dialogues avec les décideurs et au niveau communautaire également. Au niveau des décisions, il y a eu des prises de décision. Nous avons eu au niveau national des échanges pour pouvoir mettre en place un partage périodique de données et également au niveau des districts, des réunions trimestrielles de partage de données au niveau des districts. Et nous avons dynamisé les projets au niveau de Agro-Baoulé à travers le GTP, le groupe technique de travail qui nous a un peu appuyé. Alors, nous avons eu également des renforcements de capacité. Des renforcements de capacité au niveau de ASAPSU. Nous avons eu à être formés par rapport à la mobilisation de ressources, la gestion des achats, la planification stratégique, la renouvelabilité et la politique de genre. Et au niveau national également, nous avons eu à renforcer les capacités au niveau national et infranational. Nous avons eu à renforcer les capacités des membres de la société civile pour sur la renouvelabilité sociale. Au niveau du district, nous avons eu à former des pharmaciens à l'interopérabilité entre le ICI et le M-Supply et également sur le système de santé. Au niveau de la communauté, nous avons eu à pouvoir former la communauté à l'utilisation des tableaux figuratifs qui sont des mécanismes de retour d'information. Diapo.
Liliane, words wrapping up, please.
Il n'y a plus suffisamment de temps, donc de passer aux leçons apprises.
Diapo. Alors, nous avons appris plusieurs leçons, notamment le cadre d'échange d'informations renforce la coordination et l'apprentissage des pôles, l'implication surtout du gouvernement à travers le groupe technique de travail qui est piloté par la directrice de la DSIMI. Et nous avons vu que les engagements publics à travers la DSIMI et le GTP qualité représentent une garantie pour l'appropriation de la renouvelabilité sociale au niveau national. Et aussi, bien qu'étant nouvelle dans le domaine au niveau de la Côte d'Ivoire, l'approche PET est une occasion de relever les défis liés aux produits au niveau de la fourniture des produits SMIPF. Diapo. Alors, les prochaines étapes, nous avons la mise en œuvre. La mise en œuvre se poursuit avec un deuxième cycle de financement de USAID Momentum. Et également, nous allons documenter pour saisir les résultats et les apprentissages afin de récolter d'autres résultats. Et nous allons mettre en œuvre des ressources au niveau des outils PET qui vont nous permettre de pouvoir poursuivre le processus qui a été enclenché depuis 2023 et aussi l'organisation d'événements d'apprentissage, notamment des webinaires comme celui-ci. Diapo.
Merci.
Merci.
Thank you so much. And for those who are wondering what PET is, that means Public Expenditure Tracking Survey, a methodology that ASAPSU and the TAAC Hubs Sierra Leone applied in their social accountability work for commodity security. We'll now move very quickly, colleagues, and I hope you are streaming your questions and insights on the Q&A site so that presenters can start reacting to your issues. So I'll move to Sierra Leone and Mbuya Nambia Mbagura, President of Youth Action Movement Sierra Leone, FP 2030 Youth Focal Point, and the Executive Secretary of the Adolescent and Youth National Mechanism will be presenting the Sierra Leone Adolescent and Youth TAAC case study. Over to you, Buya.
Hi, thank you so much. And I'm so happy to bring you greetings from Sierra Leone, from our team here. I will be taking you through our presentation as a country with regards to the TAAC Hub that was not only sensitive to being inclusive, but then youth-led. Importantly, this is a situation where as a host institution, the Health Alert team decided to have other members coming on board. And we looked at priority areas to look on: RMNCAH, public financing, gender, education, climate change, and how can we link that to SRH? Importantly, we were able to have a broad network of civil society engagement with the need to strengthen organizational and individual capacity. And this was successful enough. We started in 2022 with just about 7 membership, and importantly, in 2023, we recorded about 53, and young people are inclusive. Next slide, please. Yes, so in terms of the outcome harvesting at the national level, because of this youth involvement, because of this civil society moving with one voice and in solidarity, we were able to have a broad engagement of government, just like other speakers stated. You can see the rest of them. But what stood out so importantly for us as a country is the innovation of an annual National Adolescent and Youth Family Planning Conference that importantly brings stakeholders, ideally young people and adolescents as well, to see how they could share their thoughts in terms of driving the family planning and sexual reproductive health space development in general. We were also able to have media practitioners to come on board. We signed partnerships with national stations and all of that. But like I said, you see in highlight is the AY mechanism. Currently, we have for the first time an adolescent youth inclusion mechanism that is now bridging the gap between government, civil society, donor partners, and these adolescent and youth groups, so that we speak with one voice. After that, we needed to have our involvement in data. The AY FP 2030 commitment abbreviation version was also very important. When the FP 2030 came into force to see how we could review the 2020 commitment, then adolescents were largely involved through this TAAC movement. And we were able to develop an adolescent youth FP 2030 abridged version so that it can encourage young people to better understand this commitment and also how to as well be accountable through our various stakeholders. Importantly also was to see how we can develop a 2-year smart advocacy evidence-based plan so that we hold duty bearers accountable. Through the work of Samasha, we were able to help to have a motion tracker dashboard that would also, like I said, warrant to have more output. In terms of the dialogue, we also committed as a team and as a youth involvement and youth-led, again, we have the FP 2030 commitment reviewed and launched by the Minister of Health, and currently, even as I speak, as the FP 2030 Youth Focal Point, because of this TAAC Hub involvement. And we were able successfully to also have the family planning costed implementation plan that also strive to see that we have a boost in terms of uptake for modern contraceptive prevalence and also having a reproductive health. But the details are already specified. You could please find time to go through. In terms of decision making, importantly, now the adolescent and youth mechanism is functional from the national, regional, and as well the district level. This is a mechanism that is so inclusive. It has key population membership, child rights movement, and all of that. Now we are seeing that if we have to have the National Adolescent and Youth Family Planning Conference, it should be youth-led, and the AY mechanism is now championing that. We are also now at a point to see that whatever engagement the government is taking through the RH program, the reproductive health program, and civil society, young people are there. And importantly, also what we did as a country is to see how we could advocate for increased investment in terms of family planning and sexual reproductive health. And now there is a budget line dedicated for FP and SRH. Next slide, please. Just very quickly, from this national level, we recorded almost the same because we believed in decentralization to the sub-national level. And now as we speak, at all 4 districts of the MCGL project from Pujong, Kailaon, Western Area Urban and Western Area Rural, we were able to successfully cascade all of what happened at the national level to those districts. And importantly, we also went beyond even the MCGL supported district. In terms of data, the same, just like the national. In terms of the dialogue, we also intensify dialogue. In terms of decision making, now at the district level, local councils have also committed to have more investment, more engagement of young people. And then when you go, next slide, please, you realize that we extended our involvement and our engagement at the Pan-African level. Now the FP 2030, we are visible. The Africa Health Budget Network, we are as well visible. Sam Marshall Medical Foundation also supported us with the training on motion tracking. Now adolescent and young people, after the validation process anytime soon, can be able to as well see that yes, as a country, we made this commitment that we want to increase investment in financing. We want to see that supply chain management is prudent. How can we track that progress? That has been so successful. You can see the investment category that apart from the MCGL supported funding, we were able as a team to also mobilize about $450,000 from different other sources. This is for sustainability. Next slide, please. Again, for coordination, we were able to have all other TAAC membership fully trained, not just the lead convener Health Alert, to ensure that sustainability stands. Again, for young people, we also developed what we call the master trainer, for example, for smart advocacy. These young people now, even if TAAC as a movement cannot have any funds from the MCGL project anymore, they can be able to sustain these learnings to other institutions. Next slide, please. What are these learnings, just to wrap up, what are these learnings that we have as a country? With a deep understanding of the needs as a country, you make your local needs assessment, you have irrelevant data, you know the decision makers. Importantly, this can drive sustainably local-led development. Again, what we also learned is the fact that if you have multi-year funding and funding diversification, that can drive your sustenance in terms of your interventions. Capacity strengthening is also very key in terms of local-led development because that can provide the skills, tools, and all network that a movement needs. Strengthening the institutions of these individuals at a local level is also essential to ensure that convening, coordination, and facilitation is possible. And for data, the need for data literacy should not be overemphasized. I want to thank you indeed. Just as we go for next steps, we want to see that this AY mechanism continues to thrive. Also, this movement of about 53 TAAC coalition membership also continues. I want to thank you and also invite that because of time, I will not give you all of those mighty things we did, but we are open as a team for more engagement in this, and we are so grateful.
Thank you, Mbuya. Thank you so much. That is Sierra Leone. We've heard from all the speakers that government involvement and partnership was indeed very successful. We would actually like to hear now from one of the governments, and that is from Victor Karim, who is in the docket of the National Secretariat for the Reduction of Teenage Pregnancy and Child Marriage, Ministry of Health and Sanitation in Sierra Leone. So Victor is, we've heard about the incredible work that Mbuya has just shared. Kindly share your remarks on how the AY mechanism and the network approach has partnered effectively with the government and your secretariat docket to expand access and quality reach of services to adolescents and youth in your country. Victor.
Thank you so much. I don't know if you can hear me clearly.
We can.
Are you getting me? All
Yes.
right, thank you so much. Just to set the context, Sierra Leone as a nation, we are driven by a young, youthful population. And as such, inclusivity in terms of all interventions relating to young people is very critical at government level. And even in terms of space, you see much more younger ministers. It tells you how attached we are as a nation in terms of driving the issues related to young people. Now, that is just to set the context. Coming down in terms of our key interventions, young people in terms of decision making are very critical. And when it comes to their sexual and reproductive health issues as well, we pay key attention. And that is why as a secretariat, in as much as we know as a government body, we have the firm belief and conviction that we cannot do it alone, but we need partners. And I think MCGL and inclusive of Health Alert and all other organizations have been very much productive to our work in ensuring that we engage these young people by making sure we provide quality services, reach them where they are unreachable, taking those pains and ensuring that we get to their doorsteps with services that is actually we help them in terms of making key decisions about their inside vis-a-vis family planning and what have you. So as a government, we have taken cognizance of their relevance, and that is why we think we cannot do it all by ourselves. But with MCGL, with the credible work that they have done, it's a testament to a very good partnership in terms of collaboration, coordination in all of our programmatic interventions. I just want to highlight key interventions that we have collectively done together. Like I said, we are presently on the verge of validating the document of providing adolescent health standards to our key young population. This has been mainly supported by MCGL, hiring a consultant, and that consultant has done a very incredible job, which we are very proud of as a secretariat. And as such, their voices into that document has been very, very much key, because we want to transform their lives. We want to ensure that they take the right decision. Even the strategic document that we have, which guides our operations, which is a national strategy, which has expired in 2022. Now, as I speak to you, all of us are together reviewing the costing framework. It tells you how collaborative we are in terms of our operations. And as such, we just want to see our young people thrive. And I think this AY mechanism has been very much productive, because we have held several conferences on family planning, summits that have been organized through the support of MCGL, JPIGO, and the like. And the secretariat has been very much, we have been very much, we have been at the spotlight, because the youth, we know, we have their own way of reaching out to them, and they can better address their issues because of their own age bracket. So we want a continuity, we want their inclusivity, their involvement into all of our programmatic intervention rights across the board.
Thank you so much, Victor, for that conviction, but also providing a safe space for young people to effectively engage in policy making. And we appreciate the concrete results that you've mentioned, that you've been able to co-create and continue with policy reforms in your country. Before I open very briefly for the questions and answers, I would allow me to be flexible a bit with our agenda and move straight to Aya, Senior Health Specialist, USAID Sierra Leone. Aya, could you kindly share with us what you've witnessed and especially your perspectives around how sustainability could look like from the policy of USAID, and particularly what you are seeing in Sierra Leone right now about locally led development. Aya.
Yeah, thank you very much, Facilitator. We are pleased to be on this dialogue and to share our experiences. Thanks to the folks who've done so on behalf of Sierra Leone. For us, like you rightly said, we are supporting this initiative through MCGL JAPIGO, which is our bilateral that we are working on this country. In terms of your question on sustainability, for us as a mission, we are exploring ways to directly work with local actors through, in the future, looking at providing 20% of our funding in the next 3 to 4 years to local actors. So we'll be supporting, one of those will be supporting the Ministry of Health to improve family planning services for youths and adolescent population around robust community engagement and strong advocacy. So in that direction, what we have done as a mission also is to develop our localization strategy. We've done a landscape assessment of the local actors, and we've seen who is operating where and doing what. And now we are now trying to complete the strategy on how we can roll out engagement and building capacity for local actors to take the space to be able to receive our funding. And that's why we are grateful to MCGL for supporting Health Alert and the coalition team there to build their capacity in terms of robust monitoring, evaluation, development of strategies, both communication, gender, strategic plans, financial policy development, and financial procurement compliance and fiduciary management. So those capacity building efforts are ongoing through JAPIGO, through our support to this local partner. And down the line, we are looking at the issue of, in terms of, for example, making sure that once their capacities are built, we'll be able to support them through mechanisms that we call in USAID transitional awards. So it could be an issue of JAPIGO taking the would-be potential local actors through a kind of transition process, guiding them alongside implementation to make sure that they know the procedures, processes, and their financial and procurement management compliances are well in place. So these are some of the issues we are doing. Over to you if you want to ask more questions. Over.
Thank you so much, Aya. You've basically helped us to appreciate where the mission stands. I'm very excited about the just about to be concluded strategy and the belief in the work that this network has done and the deep understanding of where they are. We did not only just focus on the technical capacity development for advocacy and accountability as a technical area, but you've also mentioned other areas such as the setting up sound financial systems, strategies for expanding programmatic approaches to include gender, etc., that you are aware of. And that has happened across all the TAAC partner organizations with a lot of support from diverse colleagues within Momentum. I would say that you've had a lot of mention about JAPIGO, but actually I would say that PACT did also a lot of work with the ITOCA and in some places begin to orient us on the honor work to strengthen the networks. So our time, this session was meant to be for 75 minutes. We do have a few minutes left, and I want to open the floor for questions so that we can also be inclusive of the participants' perspective. Thank you. We are encouraged to speak slowly so that our interpreters can keep up with the pace of those who are speaking. Apologies.
Angela, remember our participants can't unmute, so you have to pick questions from the Q&A box.
Yes, and I'm going there. So there's a question from Jill Tunyaga. Given the political situation in Kenya and Burkina Faso with riots, people being shot, government, how can the CSOs operate safely? As someone from the US, I'm well aware that we have faced and may face again the situation ourselves. So that is a question to James. How, as a network, are we dealing and facing the political situations there? We have a question to India on data use. How do you ensure that data is consumable, palatable to citizens, especially those who cannot be able to interact with big data? And I think Amit, elaborated on that, but he can speak about it again. To Sierra Leone, we have a comment there that Sierra Leone is rolling out Saving Lives in Sierra Leone phase 3 and is focused on health strengthening. How do you ensure that we have inclusive family planning and sexual reproductive health in those developments? So I think what Kamara was saying from Sierra Leone is that he did not just, what he meant by being inclusive is not just young people, but how we include persons with disability, especially young boys and girls. I think Buya touched on that a bit, but he can touch on it again because TAAC is a place for everyone. Then we do have Aya, a question for you. You're being asked whether the forthcoming localization strategy addresses localizing, monitoring, evaluation, and learning, data generation, and use to inform programmatic decisions. Let me pause there and ask the speakers, starting with Aya, to answer the question on your strategy.
Yeah, sure. Thank you very much, Zunga. Surely the strategy is going to look at measurement, evaluation, resource and data generation. We will have to, down the line, evaluate the strategy. We'll have mid-term evaluation and final evaluations. So the strategy will definitely make provision for programmatic data collection, routine data collection within the interventions that will be happening to be able to evaluate the validity and the veracity of the strategy going forward. So there will definitely be, MER data generation and use within the strategy. Thank you.
Thank you. Buya, inclusion of young people, especially with disability, boys and girls.
Yes, so like you said, I started providing remarks on that already. That was the more reason why we decided to have the formation of the Adolescent Youth Inclusion Mechanism. And of course, as you can hear the name, Adolescent Youth Inclusion Mechanism. Youth, not just the ones that are going to school, we are also looking at the ones that are out of school. We looked at even the composition of this AY mechanism. We decided to have it inclusive. At the National Steering Committee, we have 7 members, and there is somebody represented from key population. There is somebody that is a disabled representative. There is somebody that is from the child rights representation, who is the president of the Children's Forum Network. And we also have other members. That is how diverse it was. At the regional level, we also looked at the geographical implications, because we don't just want to have every members of the AY inclusion mechanism from Freetown, for example, that is the city. We need to have the flavor, the representation of all others from the region. And we even went ahead to go to the point of targeting districts. So from the National Steering Committee, regional, and that of the district level, we try to capture all of those other aspects in terms of inclusion. Thank you so much. And in fact, that is the more reason why normally when we have our brief meetings, we also try to have the involvement of other civil societies. For example, coordination of the AY mechanism is led by two people. One is Health Alert, who is the lead convener of TAAC here in Sierra Leone. And another from the government perspective is the reproductive and family planning program of the Ministry of Health. That is how inclusive this whole structure is. Thank you.
Thank you, Mbuya. Aya, we have another question for you. Is data available to everyone, including the youth themselves, so that they can use it? I think this question is more about how open and accessible the strategy will be to everyone.
Well, basically, the strategy is going to be a cooperative document. I mean, we are going to get buy-in from all folks and all shades of opinion, both government, private sector, I mean, the local actors there, and then even traditional rulers, etc. The issue here is that we want national ownership to this document, and it's definitely going to have data, like we said, inclusive, that the youth can use. Currently, these folks should be aware that through MCGL, we've developed an app which they call Me Body Me Right, which is basically a youth-developed app facilitated by MCGL, where youths exchange information, ideas, data, etc., on where to get services, how to get services, what type of services are available, and where, etc. So those data are routine, I mean, programmatic data that will be generated. And in addition to that, we are not going to only rely on the program data generated. We shall fall back on secondary data. Maybe if we have a DHS data or we have other surveys that will be conducted by various actors, we will look at those data and try to triangulate our data from whatever source we'll be collecting to make sure that they are speaking to each other, or they're giving us some results that are aligned with each other. So definitely data will be key and central to the actions that we'll be doing to inform programming as we proceed. Over.
Great, thank you so much, Aya. And now to Côte d'Ivoire, Paul and Liliane. A comment here, good work with the public expenditure tracking and social accountability work. So the question for you is, how are you working with other organizations, including USAID mission, to ensure that domestic investments in family planning are increased, because the country is heavily donor reliant, with only 24% being funded for commodities by the government. Any engagement, then the second question is any engagement with the adolescent and youth for them to lead on advocacy work. Paul.
Alors, au niveau de la stratégie, il faut dire que la stratégie qui a été mise en place, d'abord, les données que nous avions avec la mise en œuvre de Momentum nous ont permis d'avoir des données assez crédibles pour pouvoir engager pleinement le gouvernement, non seulement le gouvernement, mais aussi la coalition des organisations de la société civile. Au niveau de la Côte d'Ivoire, l'analyse situationnelle a montré que la santé maternelle et la planification étaient majoritairement financées par USAID, UNICEF et BNFPA. Et la partie nationale, le financement au niveau de la partie nationale était assez faible. Et donc, à travers le projet Momentum, les évaluations faites avec les directions nationales nous ont permis de leur faire comprendre que l'État doit mettre beaucoup plus d'argent et doit s'impliquer davantage à travers la redevabilité et s'assurer de la qualité des services et la disponibilité des produits de planification familiale et de santé maternelle, néonatale et infantile. Voilà un peu ce qu'on pourrait dire au niveau de cette question.
Thank you very much, Liliane. I encourage all the speakers to answer through the worksheet that has been provided, the remaining questions. I will have Amit for 1 minute talk about sustainability. There was a question. Now that MCGL funding, USAID funding has come to an end, what is your 30 seconds comment about sustainability? I know you spoke about that, but
Just
you can
quickly,
just
quickly to answer that is that we still are connected and we reach out to each and every member of the group in spite of the regular programming being ended and share important annexures, important government guidelines, important funding opportunities. This is an on and off since Jharkhand has other collaboratives too, where we regularly meet under the banner of this TAAC. We are connected with each other. And as we have discussed that the leadership pattern will shift with a certain period of time so that all come together, all are accountable. So making them accountable and with a common agenda, we look forward to the sustainability of this particular and very vibrant group known as TAAC. That's it. In a very simple sentence.
Thank you very much, Amit, and thank you all the speakers. So now I will turn to Anne for closing. Anne.
Thank you, Angela, and thank you everyone for giving me this opportunity to say a few words of closing. My name is Anne Fitzer. I'm the Director of Family Planning for Momentum Country and Global Leadership, and I think you will agree with me that we see that civil society is willing, is able to tackle some very difficult inclusion issues, to tackle access to family planning and other services, and to improve the functionality of the health system. So TAAC has laid this grand vision to shift the paradigm of who makes key decisions, policy and program decisions, and for those decisions to be strongly held at the country level. For me, this is an operationalization of the advocacy and accountability framework that was laid out as a central focus of FP 2030. It's what is different about this decade from the previous decade of FP 2020. So it's exciting to see all this work. I really want to recognize all the partners. Many of you have shared what your work has been about, but there are so many others in your networks of TAAC that also have stories to share and that aren't here, and I want to acknowledge all of them as well. I also want to give a shout out to Angela Mutunga, who has crafted, with colleagues from civil society, has crafted this grand TAAC vision years ago, from her days even before joining Momentum Country and Global Leadership, from ICPD Plus 25 events. And she is like tirelessly and steadfastly supported the implementation of this TAAC work across countries with all of the speakers represented here and many more. It's been, she has this unique ability to sort of instill the passion for country-led, locally led development and for having the action on the ground level. But it takes more than passion. It takes a lot of hard work from many, many people. And I'm just thrilled to be able to share some of these stories today on behalf of Momentum. I also want to assure all participants that we will be sharing both the slides and a link to the recording. So if things have been a little bit difficult to follow, because we've gone very quickly, those resources will be available. I also want to thank James and Carolyn and Angela P. and so many others who've been able to make this webinar possible. I want to thank our colleagues from USAID, Aaron and Aya, Thank you so much. And we're thrilled to have you join us today. Have a good rest of your day and evening. Thank you.